I'm Gina Cipriano. I'm going to be doing a newborn assessment. I don't have a newborn, so I'm going to be using my son, Javen. He's 8 years old. So I'm going to start by getting, I would start by getting his weight, his length, and his head circumference. And then I'm going to feel the hair, and it should be fine. And then you want to feel for the fontanelles on the anterior, which should be soft and flat. And then the posterior, which should also be soft and flat and diamond shaped. Going to get his temperature. Okay, temperature's normal. Should be between 97.7 and 99.5. And then you want to look at their face. Make sure that their eyes and their ears are symmetrical. You want to bend and flex their ears to make sure that they bend and go back into place. And then you want to check their nostrils and make sure that the airway is patent. So I'm going to plug one side while he breathes, just to make sure that it's open. And then I'm going to do the same to the other side. And then I'm going to look at his lips, check the color, make sure they're not blue, make sure he's getting good blood circulation, and they're pink and moist. And then you would check the inside of the mouth by putting your finger in and feeling their hard and soft palates, your pinky finger. I'm not going to do that right now because I don't have gloves. And then when you do that as well, you would check the sucking reflex, so they should suck on your pinky finger. Okay? And you want to feel the gums and the tongue, they should be moist. And then you want to stroke the sides of their cheek and check their rooting reflex. They should turn to the side that you're stroking to. Okay, and then you want to check their neck. Check their range of motion. Good. Make sure that their trachea is midline. And then you want to check their torso, so start at their clavicles. Make sure that there is no tenderness or pain, fractures or anything like that. Range of motion. So I'm gonna move his arms, make sure everything's moving. Okay. And then I'm going to check his fingers. Got all 5 fingers. Gonna check his finger grasp. Grab my finger, squeeze. Other hand. Okay, that looks good. And then I'm gonna listen for some lung sounds. And all while you're doing this, you should be looking at the skin just for any abnormalities, any birthmarks, any rashes.
What's that?
Okay. So lungs sound clear. And then I'm going to listen to some bowel sounds as well. So actually, go ahead and lift your shirt back up for me. In all 4 quadrants. Okay, sounds good. And then you want to just look at the shape of their stomach. It's typically round. You want to look at their the way they're breathing. So you want to see a breathing coming from the belly. If they were in distress, their chest would be, you would see it more in their chest versus their abdomen. So you want to make sure the nipples on the chest are symmetrical, which they are. And then capillary refill in infants, you do right on the sternum. So you just hold down for about 5 seconds, and it'll blanch, and all the color should come back within 3 seconds. And then we're going to listen to the apical pulse. Back up.
I'm gonna breathe.
Just breathe normally. Okay, sounds good. And you're gonna do that for a full minute. We're gonna wanna listen to the brachial pulses. You want them to be equal and strong. Okay. And then this one, okay. The Mora reflexes, so in an infant, you're going to take their arms, lift them up, and drop them. And the baby would drop them and bring them back to their sides. Okay. And we're not going to do genitalia in this video just because we can't. You want to make sure that the legs are equal in length and that they are symmetric. You want to make sure they have all their toes, and then an infant should grasp your fingers with their toes. Yep. Yep. And make sure they have a good range of motion.
Feels good.
Yeah. And then the Barlow maneuver, lift the legs up and then out. And it shouldn't pop. If it pops, they could have a fracture. And then you want to listen to their femoral pulse, which is right in their groin.
I don't tickle them.
And so next you would have them turn over. Can you turn over for me?
This way?
Yeah, that's fine. That's good. And so when they turn over, you just want to make sure that their shoulders and their spine are straight, as well as they're tight in a tight position, and that they're able to hold their head up. And so, yeah, that's basically that. You're also going to check their gluteal folds, and you're going to check their lower back for any bulging or any lumps or any abnormalities that are there. It could be a sign of a neural tube defect. And after that, you are all done. You just want to make sure they have a dry diaper on and that they're comfortable and they're re-swaddled back up in their blanket.